Okay, good morning, everyone. So thank you all for attending our town hall meeting. We have quite a bit of information to get to all of you this morning. And then we've also left time for questions and answers. A lot of you have already sent us questions through the email process, so we appreciate that, and we'll try to get to all of them if possible as time permits. So the kind of the theme for this town hall meeting is the future state of Episcopal Health Services. And we are, as you'll hear, as we go on with our presentations and our presenters, we're very specific in saying Episcopal Health Services, because Episcopal Health Services is our corporation, it is our system, and it is not just St. John's Hospital anymore. And so we're going to talk a little bit more about that. But I'd like to start off just by saying that during 2021, after the height of the pandemic and things started to calm down a little bit, the leadership team here created a strategic vision for the future of the residents of the Rockaways, the Rockaway Peninsula community, by talking about a new strategy for the organization. So the first thing that we did do was we conducted a CHINA, which is a community health needs assessment. We recruited a consultant to do this work for us that met with the community. The New York State Department of Health helped us pay for the study. They actually paid for the whole thing. And basically what it was to determine the community health needs, how we can build healthy communities in the Rockaways, and then taking that analysis and the feedback that we got from the community, building on a 3-year strategic plan for the organization. And then we would take that information and prioritize it, and then get all of the buy-in from our constituents and stakeholders, and especially our board of directors. And so we started to roll that plan out in July of this year. I think many of you saw the booths that were out at the annual employee picnic. So that's where we started to roll the plan out. Just to briefly recap, and we could get more into depth at this at another meeting. The 5 organizational priorities, which took into considerations our patients, their family members, our community, and our team members, were to enhance patient, family, and team member experience, to improve the financial performance of the organization, to build and invest in 4 or 5 key service lines, and you're going to hear a little bit more about that as we go on today. Improve our community health outcomes, and improve our public awareness and focus on reputation. So those are the priorities that was in the strategic plan, that's in the strategic plan that we're going to be working on over the next 3 years. And it's important for us to make sure that we have good data so that as we go through this process, we understand what the impact of our plan and the new services that we're going to be bringing to the community, how those are going to impact lives and health of the people that we serve. So it's pretty important to us to focus on that. And as many of you know and have heard me speak over the years, we are about this community. We are about the entire community, and we are about taking care of the people in this community, whether they're patients or not, because we're more to the community than just the local hospital. And so when bad things happen, we never close. We're always here. And so the main focus over the next 3 years is going to be improving health outcomes, taking care of the community, and providing new services. So today's town hall meeting, you're going to have an opportunity to hear some updates on what we've been doing, what has been done, and what the future is going to look like for Episcopal Health Services. We're going to have questions and answers. Like I said at the beginning, many of you have already sent in your questions. If you need to ask a question, you can type in your questions on the Q&A tab that's on your screen. And we have assistants in the conference rooms who will help you with getting your answers in the queue. So you're going to hear today from Mr. Guido to talk about the financial situation of the organization and the financial future. Dr. Parker about our operational updates and what's going on with all of the construction and other things that are going on in the organization. Renee Hatzick-Moats is going to talk about our external affairs update and what we're doing inside the community and the community at large, and how we're working with the community to improve things at Episcopal Health Services. Sharika Gordon is going to give you a human resources update. And Karen Gleason is finally going to wrap things up with a quality update, and then we'll open it up to questions and answers. So that said, I'd like to turn the microphone over to Steve Guido to give a financial update.
Thanks, Jerry. So we continue to get a significant amount of support from New York State Department of Health. Has been very supportive on providing the funding that we require to run operations every year. There's unfortunately a growing number of hospitals that require support from the state, as we all know. So there's a growing list of hospitals that are vying for support from the state. But we continue to get the support we need. One of the things that's a little different now, really for the first time, the state is going to enhance the Medicaid rates. So instead of always having, insufficient rates for each patient we treat that's insured by Medicaid, and then relying on supplemental support to meet our budget needs, we're actually going to get an enhanced rate for many of the services we provide through Medicaid. This is particularly significant because in the past, where we've wanted to grow programs and invest in programs that are needed in the community, it was hard to do in a financially viable way without those rates being at a fair level to cover cost. So with the enhanced rates, it's really incentivized and provided a mechanism for us to grow programs and some of the things that Jerry mentioned as part of our strategic plan. We now have a financial path to do it. And so we're really excited about the new approach the state's taking and providing enhanced Medicaid rates really to just the true safety net hospitals that have a high percentage of their patient volume that comes from the Medicaid program. So we'll continue to work on our own financial improvement initiatives internally. Obviously, we need to continue to be good stewards of the money that we get from the state in terms of managing our costs the best we can. But the majority of our financial improvement initiatives are now going to be focused on growing programs and increasing volume in our existing programs, which is going to have the biggest positive impact on our financial results. So that's all really good news, for the future. I think that's really it from the finance update. Chris, you want to talk about some of the construction projects?
Yep. I kind of wanted to do a little different than just giving people an update on construction and tie it back to what Jerry and Steve were saying about how it supports the community health needs assessment, the strategic plan, and kind of this new financial model, which is, like Steve said, allowing us to maybe invest and grow some services that we would have struggled with before. So, kind of the division or the vision is really developing EHS into a widely distributed, integrated healthcare delivery network. So, we've had services here and there. We haven't necessarily been fully integrated in making sure that all of our kind of patients stay within our system and receive as much of services as they can from us. And we haven't always been as distributed as we need to be with a very kind of main campus focused. And so you'll see as I go through this, we're trying to kind of geographically expand and integrate kind of all of our ambulatory and inpatient hospital-based services. So we're really focused on growth, expansion, modernization, and kind of the clinical programming that we provide. So you're not going to be able to remember everything I talk about because there's a lot of projects, but if you refer kind of back to this, growing, expanding, modernizing, and providing a full array of services is kind of where these projects are all kind of focused. So I know a lot of people have interest in just where we're at with this recovery from the fire. So it's been 11 months and a week since the fire. So we are making finally some progress. The roof underlayment's on, the railings are up, and the membrane should go down soon. So I think the new roof will finally be done. But if there was a lesson in bureaucracy, it was really between working through DOH and permits and construction and lead times and fabrication, all that kind of stuff. It took a very long time to do what seemed like a simple project, which just put a new roof on a place that needed one. But that is almost done. So before winter, we'll be good and good and weatherproof before we get into that. So Tower 11, we are working through the permit. I actually believe we'll have a permit in the next, or the CON in the next maybe 30, 60 days. In the meantime, we're just waiting on some mechanical quotes so we can get it out to bid so that when we get the CON and everything, that we'll be ready to launch. So I would say in the next, 60 days maybe or so, it all depends on how fast the Department of Health approves the CON. But once we get the bids, we know who's going to do the job. We can start the demo and all that kind of stuff. So, and as I talk through these, and I know a lot of you already know this, there's a lot of dominoes. There's a lot of projects backed up behind other projects. So it is very important to finish up Tower 11 because there's a variety of projects kind of backed up behind there. So the first ones I put on here are just the hospital projects. So the Tower 8 and Tower 10 realignment project is pretty much done as far as the patient rooms and the staff lounges. I think we just got one more lounge to do and one more room to do. And then once Tower 11 is done, this is one of the dominoes, is flipping those units one at a time up to 11 so that we can redo the nurses station and all kind of the staff support areas, the hallways, the lights, and all that type of stuff. So Tower 11 will get done. Tower 8 will go up there for a while. We'll finish Tower 8. Tower 8 can go back home. Tower 10 can go up there. We can finish Tower 10. And then we can finally open up Tower 11 and close down Tower 3 and Tower 7. So, those are dominoes. Going to take us, I don't know, maybe 8 months or so to build out Tower 11 and maybe 3 or 4 months after that. So roughly a year from the time we start, all of the inpatient units will be redone. So when we're all done, it will be done. So the entire kind of inpatient medical surgical area will be done, modernized, much more support for the people who work on the floors, that type of stuff. Labor and delivery is, the plan is finalized. So we're going to build on the 9th floor, 6 LDRPs and 2 new ORs. So that will be a brand new state-of-the-art gut renovated labor and delivery service. And then we will build a few extra postpartum rooms downstairs. If we build 6 rooms, we'll probably easily be able to more than double our volume. But once we get busy, there'll be times when 6 rooms isn't quite enough, and we had to flow down to the 7th floor into a newly renovated postpartum area down there. So those plans are done. We are just waiting for, again, in the domino series, the clinic to move out so that the people and services on the 9th floor can move off, and then labor and delivery should be able to start. So working through the CON and all that type of stuff on there. If folks have been to the 6th floor, we pretty much finished up the administrative suite, just waiting for some final signage and trying to make that floor not Grand Central Station like it was, but much more of a professional administrative suite. Tower 5. So everything that's on Tower 5, the clinic now is moving over to the new building, what we used to call the teaching center. And then on to Tower 5, is a bunch of services from 9 that are going to move down and get relocated. So again, that all depends on when that building gets done, which I'll go into here in a little bit. Tower 4, we have had pretty good luck between Renee's team, Nancy Fox, Nancy Lakehart, Renee, getting money, getting grants, getting political support to get money. So one of the big things we're going to be able to do is renovate the Tower 4 behavioral health unit. It was never really built to be a behavioral. There's a lot of blind corners and places, just not how you would design it from scratch. A pretty significant, probably $4 or $5 million renovation is going to happen to Tower 4. And as soon as we can get that money secured and all of that. So that's probably coming sooner than later. In surgical services, we've done a fair amount of upgrades, but most of what we've tried to do in there is modernize. We have much more modern equipment and videos and microscopes and instrumentation and all that type of stuff. The emergency department, we are going to build out a CPEP, which is a psychiatric evaluation area. So, we do good behavioral health services in our ER, but there are things that we can do better with a little bit change to our facility. It will also get reimbursed better for the kind of the care that we provide down there. So that is also pretty much every one of these projects is on a timeline to get a CON, and then we can get permitting and get started. Again, the dominoes being the thing that might slow us down here and there. And a lot of we're just doing a ton of internal service and relocation. So, patient relations have moved, guest relations, care management's getting some more space, population getting some space, employee health is expanding. We need to give the residents more work rooms. The lab, we're in the middle of one modernization, kind of help them out up there. Probably have several more to do there. So just a lot of kind of little internal moving around support teams, clinical teams, that type of stuff. So that's a lot. Many of them are going to go on at the same time. Some of them are dominoes waiting for other things to be finished. But over the next 24 months, I think you'll see the hospital itself be a much more modern, much more inviting, much more consumer-friendly facility. With that said, I didn't want to have people listening and think we hadn't thought about them. We do realize that the lab has some issues. We've been able to modernize some of their mill work and fix up some of their areas, but they are very space constrained there, and we'll need a plan to address that down the road. Pharmacy is also very space constrained, and as the cancer program grows, that's a very pharmacy intensive service, and we have to do some work there. Probably our biggest project that we have actually a drawing for, but don't really have a strategy for how to pull it off, is to renovate the 3rd floor critical care area. Take Tower 3, ICU, CCU, gut that whole floor out and build a brand new state-of-the-art critical care area. It's around 15 to 20 million bucks probably to do that. So I don't have any doubt we'll find the money somewhere. It's just a big deal for how do you provide critical care? How do you phase it? But we know that we have to do some work on our critical care areas. And then in our lobby, we want to put an optometry/ophthalmology program. So we have an ophthalmology residency. We don't do a lot of ophthalmology work here, and I think we can change that. And the vision for the lobby is kind of a retail core where you can get your eyeglasses, you can go to the pharmacy, get a cup of coffee, healthcare related, hospital-based clinical services. So just for those who didn't find their list on active projects, it's not that we're not aware there are still more projects that we need to plan. It's just, how much can we put on our plate at any given time? So this is a little rendering of what we think the labor and delivery unit is going to look like. We're going to move to an LDRP model. So room for babies to room in, place for families. or support people to stay over. Obviously much more modern, extremely different than our labor and delivery unit is now. So it'll look pretty close to what that room looks like. 6 of them up on the 9th floor, along with 2 new ORs. All right, so the teaching center, what we always called the teaching center, we had to come up with a name for the for the CON. So we ended up calling it the Episcopal Health Services Clinical Learning Center. So, the CLC will be kind of its official name. It is a learning center for the residents and the medical students, but it's also a clinical area because we're going to move the specialty clinics over there. So that is, hopefully, knock on wood, going to be done around April 1st or so. And then it's going to take, 60 to 90 days to get our occupancy certificates, get through all the inspections and that kind of stuff. So I'm thinking around July 1, this coming July, we should actually start to move in there. And we're currently just working on the process. So we don't want to just turn the switch on a Monday, move it in. We want to slowly move in, work out the bugs of the building, make sure the staff that works there is, just kind of used to the way everything works before we put all the services in there. So most people, I think, know the rest of this. The basement's going to house our IT services. So IT is spread all over the health system, offices here, offices there. So they're going to, be in the basement, full service for the IT. On the first floor is a conference space, the biggest room in there. So we don't have to have meetings like this where you really want 75 people to be here, but you can only fit 40. It has a pretty big conference space that'll fit 70, 80 people. And then most of ambulatory care's kind of business administrative functions will be there on the first floor. The second floor is going to be totally the clinics that are coming off of 5. The third floor has classroom space, the simulation center, and the medical library. And the fourth floor has more classroom space and a new boardroom. So some of the things that are really just substandard in this organization, like the medical library, will become a much more modern, functional place. And we are beginning to work on programming for things that are moving off, who needs space that can go in there. So the medical library is going to free up a fair amount of space, and we're working on what should go into that space. So, but that's kind of the timeline. Hopefully done in the spring, hopefully moving in around July. IT, the clinics, sim labs, classrooms, boardroom, all that kind of stuff. So I don't see anything that's going to interfere with us staying on this timeline. We have had challenges around lead times for manufactured stuff, supply chain issues, et cetera, but all of that seems to be worked out for this particular facility. So knock on wood, come spring, we'll be talking about move-in strategies. The ambulatory pavilion, as you can see every day when you come in, is moving along very, very rapidly. And it's going to be a very nice building and really modernize our campus. Timeline for that is probably finishing around July, although we did get some good news that some of the lead times for the mechanicals, the air handling units, et cetera, may have gotten a little better. So maybe it'll get done a little bit before that, but thinking it'll be done around July. Same thing, 2-3 months to get all the occupying certificates and inspections and all that, and probably move in maybe September, certainly by this time next year. So, but again, I think most folks know this. In the basement, there is going to be a radiation oncology service and the PET CT. These are services that have not been on the peninsula since Peninsula Hospital closed many years ago. So, that's really, really exciting. To have to go off peninsula, 5 days in a row to get your radiation treatment, stuff like that's a real burden. So the first floor is going to have primary care with an integrated behavioral health component, pretty much picked up out of 495, moved into this building, but then expanded with at least one more primary care physician there. The second floor is going to be the CMHC wellness and recovery programs, and then we will tear those 2 bad buildings down as soon as we can. The wellness and recovery space is going to become parking, because you have to have a certain number of parking spots for a building. So, and then the wellness and recovery will just be torn, or the CMHC will be torn down, and probably expanded employee parking over on that side over there. The third floor is going to be the cancer center and the infusion center. And then the 4th floor, again, pending grant money, et cetera, we're thinking to open an endoscopy center. So we kind of just have one endoscopy suite downstairs. Most people don't do endoscopy, outpatient endoscopy in their hospital. They do it in an endoscopy center. So we're going to open up an endoscopy center and potentially move the endoscopy clinic that's in 5 to co-locate where the endoscopy center is, because that may make more sense. All right, infrastructure upgrade. So, you know, we've been working for probably the last year and a half on this brick pointing. It is coming to an end. Soon we'll be able to take down all that ugly scaffolding that's covering our sidewalks and front entrance and all that. But the bricks are now secure. They just have a little bit more work to do on the front, and then that'll be done. We're going to try to upgrade the facade. I don't know if you have this experience, but every day when I drive to work and you hit the teaching center and then you hit the hospital, and then you see the other new building. This hospital is great, but it doesn't look modern. You know, it really sticks out like sore thumb sandwiched between 2 very new modern buildings. So I'll show you a picture in a minute what we're hoping to pull off just to make this whole main campus feel like a modern healthcare facility. We're going to do this utilities upgrade. This is maybe the most exciting thing that you wouldn't really think about, but all of our boilers, chillers, air handlers, air conditioning, you know, water treatment, all that stuff is really out of date. Some of it's been here since the day the building opened. So we have an opportunity to work through DASNY and the DOH to do about a $25 to $28 million project to replace all of the infrastructure. So some of that stuff you'll never know because it's behind the wall and you don't think about. Some of it's very patient forward, meaning every inpatient room will have its own thermostat. And we won't have this day when we turn off the heat and turn on the air conditioning, but then, you know, it's warm out, it's too hot. It's the middle of July and the ICU is like freezing cold, or it's the middle of winter and central sterile is like boiling hot. All that stuff can get addressed. Every place will have its own thermostat, so patients can be comfortable and we won't have to, you know, be bundling up in blankets and all that kind of stuff. We do have a couple of mandatory things we need to do. One is we have to sprinkle this building over the next, I think we have about 2 years to get it done. So that's obviously a huge project and has a big price tag to it that we're still working through how we get that done, but it's not really optional. You know, we by regulation have to sprinkle this building. And then with the way the electric comes into the building is not really up to speed, and we already are kind of past our deadline. So we have finished the engineering, but that's again a multi-million-dollar project to change the way electric comes in and gets distributed throughout the building. So again, fine in the 80s, not so fine in the 2020s. So those are two, at this point, unfunded, but things that we do need to get done from a regulatory point of view. But fixing the patient areas, building a couple of new buildings, and fixing this infrastructure is going to be good. So it's also going to save a lot of energy. It's getting paid for largely by energy savings. So, you know, we have very old-fashioned lights. I think we're all surprised to know that water is our second biggest utility. Water is very expensive in New York City, and we have a leaky old system. So we need to replace kind of all that infrastructure. And then that's what we're hoping roughly, you know, you'll drive up Beach 19th, you'll see the Clinical Learning Center, brand new beautiful building, the hospital, the main campus will look, you know, somewhere along these lines, and then you'll hit the ambulatory pavilion, and I feel like you'll sense that you have come to a very modern, high quality, you know, high service organization. All right, so with what Steve said about the enhanced rate for the, you know, the Medicaid population, really ambulatory service expansion is a huge priority for us. So we have a property at 34th Street. The plans are almost finalized to put a medical practice in there, probably primary care with some specialty services like endocrine, something like that. Architectural, it's almost done. Programmatically, we're still working on, while it gets built out, we'll figure out what we're putting there. 105th Street, you know, is now really a major building for us. It's got primary and specialty care. We moved rehab down there, the women's center's down there, and we have one more across from the women's center, kind of shelled space that we're getting ready to build out. That someday may be a cancer center expansion, but I think the cancer center is going to need a few years to grow the volume. So we'll probably use it for primary care or some type of specialty service. We have a property at well, Adabo has a property at 64th Street, in a new building that they're looking to see if there are people who want to put some services in there. So we've engaged in some conversation with them around what might make sense for them, what might make sense for us. And then when cancer moves out of 275 Rockaway Turnpike, we are going to do a study as to what we should put in there. So, as we talk about a widely distributed, we'll go from Rockaway Turnpike to the main campus to 34th to 64th to 105th and try to serve in a more convenient way the entire kind of service area that we work in. And then part of the strategic plan was development of service lines. So we went through a process of figuring out what those service lines should be and that we're going to focus on. So they turned out to be behavioral health, ambulatory care, cancer, and cardiology. So there are already business plans being developed for, again, expansion, growth, modernization around those service lines. We're also going to do a focused, obviously, project around obstetrics. So we're going to build a new facility, but then we really need to market and do outreach and kind of change our delivery model to make sure we can keep that program. And then we will be putting a mobile crisis team in as part of the CPEP program. And then in surgical services, we are ready to launch a new dental program, a new spine program, looking how we can expand vascular and other things. We still do a relatively low volume of surgical procedures here, and again, an area that we want to focus on. So, there's a lot. All right, we'll take questions at the end.
Morning. My presentation won't be that long, but it'll be interesting. As Jerry has stated, when he first opened up, he started off to say that this is Episcopal Health Services. And one of the things that we have done with our needs assessment, that's really what is driving our strategic plan, is really heard from the community, our patients, and all of you. And one of the reoccurring themes was our branding, our reputation. What are we doing about that? And so with all of the great work that has been done within the past 7 years, we thought that it would be a great time to rebrand the organization. As you can see from Dr. Parker's presentation, there's so much being done between 2023 and 2026. There's going to be a lot of change on the campus. There's going to be a lot of change in the community. And one of the things that we have to do is that we have to make sure that we're staying on the same wavelength. We have to understand that the branding of the organization is not just from my team, right? It's not just marketing, it's not just communications, but all of you hearing my voice in this room, you are representation of St. John's Episcopal Health Services, right? When the population health team is out in the community, Carolyn, they're out doing screenings, people are looking at them and saying, wow, St. John's is here. When Rosemary and St. John's Medical Group are out in the community or taking people in at the Women's Center or Cancer Services, they're saying, wow, Episcopal Health Services is here. So we have to understand that we all represent Episcopal Health Services, and this is our health system. So we are going to rebrand the organization to identify us more in a corporate state versus just the hospital. Many people don't know that we provide ambulatory services. Many people don't know we have a hospital foundation. Many people don't know we have a network for physicians in the community that works with us to help us with our value-based arrangements. Many people don't know that. And so we have to now begin to identify ourselves as a health system. So what I'm going to share with you today, I'm going to share with you just a glimpse of what that's going to look like. We want to first add a little color to our logo. And then here, you're going to see these are all the entities underneath the parent company. So many hospitals or many systems, you'll see like the Northwell, they have those, it's called a logo mark. They'll have the little squares, right? Our logo mark is going to be EHS. And how you identify the different entities is with the name on the side and the different colors. So St. John's Episcopal Hospital, but it's still under Episcopal Health Services. So the corporate brand will always be identified with the sub-entity, okay? So we have the hospital, we have St. John's Medical Group, we have the Eye Care Foundation, and we have Innovative Health Partners. We're a small system and we're growing. And so I want people to understand that we're not just a hospital. We're going to go through an overhaul on our website, which is going to be very exciting. A lot of the information on our website when I first came really was just, changing the design and taking the content and, trying to do as much as we can with the small hands that we had. But now we have an opportunity to really go in and take a full overhaul on our website, liven it up a bit, take away a lot of that content, put a little bit more engagement. And so Zuleika and her team will be working on reviving that with many of the different departments. And that will be starting very soon. So this is just an example. We're also going to look at opportunities, and one of our strategic priorities is looking at how we co-brand with other, managed care companies. We want to be out there. We want to be on the streets. We want our flags down, secret. We want, our posters at the bus shelters. We want to be visible. And so we're going to be working on co-branding opportunities with our managed care organizations to help us get our name out there. So as you can see, we'll have more engagement on our website, more interaction, user-friendly, so that people can really understand, who we are as a whole. And as Dr. Parker said, we are going to be changing the facade. The borough president has agreed to fund this initiative, which we are so thankful for. So we'll be applying for those funds come 2023 to change the facade of the building. Dr. Parker just showed a picture. I tried to kind of get a little bit close to the color, but basically this is how it will look with our logo and our signage on the building. Our marketing materials will change. It'll be more, to be more inclusive, diverse, and make sure people understand that we count DEI as a commitment in this organization. And also our templates for our letterheads and our business cards will be changing. We'll have Braille on our business cards, to make sure that we are inclusive, right? So there will be a lot of change when it comes to how we identify ourselves in the community and how people see who we are. So much has gone by within the last 7 years. For those of you who have been here more than 7 years, there has been a drastic change. There has been very good change. Do we have a lot more work to do? Absolutely. I do go out into the community and people still say, how come we're not doing X, Y, Z? What's going on with this? So we do have a lot more work to do, but we need to applaud ourselves for the work that has been done, because it has been a lot of work in a short amount of time. And then lastly, I do want to talk about a very important piece. Steve mentioned, us having a really good financial state right now, but we also need to make sure that we take advantage of those private dollars. And so what we did was we started a company called the Eye Care Foundation. It's a separate entity from the hospital. Nancy Leckhart is the executive director. I'm sure many of you know her because she comes after you guys so much for giving. But we launched the organization a couple weeks ago at the Rockaway Hotel with a reception, and many of you have joined, so thank you for that. But we've also launched all of the social media and digital components of it. So please follow it. Please go to the website, find out more information. This is where we're going to be able to get those private dollars in and support the strategic priorities of the hospital, as well as do a lot of our community give back. So our community back to school wellness fair, our holiday toy drive, our sponsorship for our population health van, in hopes to get a new van, because we want to make sure that we're reaching everyone on the peninsula. So these are all the only updates that I have. And at this time, I will put it into the hands of Ms. Gordon.
So good morning, everyone. I just wanted to talk a little bit about Governor Hochul's launch of a healthcare worker bonus program. And so we are an employer that's eligible for the healthcare worker bonus program, and many of you have titles that are eligible for those monies. I just wanted to share with you that if you have any questions, there's a great FAQ on that. You can just type in healthcare worker bonus program and you'll see a lot more detailed information about eligibility criteria and payment amounts for this program. But I wanted to clarify that this is not an EHS sponsored program. And so the parameters for the bonus program are set forth by the state of New York. And as an eligible employer, they dictate what are the eligible titles that can participate. But we had almost 1,000 titles that met that criteria. We made our submissions, which there was a deadline of September 30th to submit. And now the first vesting period is going to be paid on October 21st. And just basically, the criteria was that you needed to be of a specific title with a base salary of $125,000 or less. And you needed to be working between the initial vesting period that was set forth. And so we submitted that information. We did receive feedback that not all of the submissions that we made were accepted. I would just share with you that it's not $125,000 per employer. So for example, if you're working in two different facilities and your combined salary is more than $125,000, the state may deem you as being ineligible. All right, and so we did receive some of that information back, that submissions that we made, that the state removed them and said that this individual was ineligible. You should also know that there is a electronic format that we had to submit to the state that does have your social security number and all of your personal identifiers so that they're able to track that information. So, but for the most part, many of you will see those payments next week, Friday. We are preparing a separate payroll. It has also been asked that these monies not be taxed. So you should not have any state or local tax coming out of that money. And the bonus payment is going to be $1,500. If you're eligible for the second vesting period, we're going to submit that information and the second payment will be coming out. We'll communicate when that is paid, and we can only pay it once we are reimbursed by the state and they give us back the information confirming who's eligible. But you will see that first payment next week, October 21st. And if there are any questions that anyone may have with regards to that, you can contact the Human Resources Department. Right, thank you. And I'll hand it over to Ms. Gleason now. That is this Friday.
Morning, everybody. I was here to give a few updates regarding quality, and I think it's exciting when you hear everyone talk about the vision and the future and the things that are happening in the organization, because the quality of care that we give here at St. John's is improving every single day. And that's evident by our continual raising the bar for ourselves in terms of quality awards, awards that we've received for our stroke and our heart failure get better every year. Our leapfrog grade, we have made significant strides in our leapfrog. Still opportunities for improvement. We're currently waiting for our full grade. I'm confident that we will stay at the level of C, but I'm also confident that I know that we're going to push that dial next year and the year after that to make it, we're going all the way. And we do that with each and every one of you and your commitment to providing high quality care to our patients. So I think it's exciting to see that. There are different ways that you look at the quality and you're looking at the healthcare outcomes, but Leapfrog also looks at other things rather than just a standard grade. And one of them is a competitive benchmark report that I am delighted that we just received that report. and you receive a scoring for it. And we're right at the state level. So we are running with the pack, not only in New York State, but nationally in terms of where our leapfrog is. And that's something to be very proud of. So we're going to still continue to work with all of you on improving our quality, but it's an exciting day at St. John's, and I'm excited to see where we're going to continue to go as we push that dial forward with quality. I was also asked to give an update regarding the Department of Health recent survey. We did receive a citation. We wrote a corrective action plan. It was lifted that day. And what I can say is that we move on. We don't let things like this define who we are, because we are committed to our patients' safety. We are committed to providing high quality care, and we're going to move past that. So, and it's with all of you. So thank you so much. And I look forward to working with everybody.
At this time, we're going to go into our Q&A. There is a Q&A section on your screen. There's a Q&A section on your screen. So we're going to ask if you can type your questions in, and we will have Zuleika read out the questions. Those of you who are in the conference room, we're going to ask the assistants that are in there to please take the questions from the groups to put it into the chat, and we will pick it up. Yeah, she's going to read them all.
Open up to the initial room here. If there are any questions, I will go ahead and pass the microphone over to you. If there are any questions within the room. Any questions?
Hi, good morning. My name is Vanessa Herrera, and I'm a social worker at the Community Mental Health Center. You mentioned a couple of times changing the facade and making improvements to the hospital. Is EHS also in contact with local legislators and state officials to make improvements in the local streets all over around the hospital?
Thank you for that question. And so, yes, we are. There is a whole redevelopment of downtown Far Rockaway taking place right now. And Beach 20th, the street is horrific. We've put in requests to have DOT come in to fix the street, but they're not going to fix the street because they're working on the pipes further down Beach 20th Street, like towards Mott. That's where they're working on the infrastructure. It's going to get up here, but it hasn't gotten up here yet. So we are aware of that. They're aware of it. And it is a part of the process, but it's not going to take place tomorrow. But yes, they are aware. Media for the Eye Care Foundation.
Hi, my name is Karen. Since Far Rockaway is growing, are we going to be able to keep up with the demand of the patients that are coming into Far Rockaway?
I mean, I think we will, a lot of care is going to shift to the outpatient. There's still the move to less inpatient care, more outpatient care. So we have, as I said, quite a bit of expansion. With that said, we'll be challenged to find, physician recruitment, social work recruitment, and so all the people we need to provide the care. Workforce maybe being more difficult than actual capacity to take care of them. But as we track the growth and the needs of the community, we try to be ready to, kind of be a step ahead of that. So I think we're going to be okay. I do.
1 second. We do have a question from our Q&A here in Zoom. The question is, what are we doing to help encourage recruiting and retention?
So we have begun an aggressive approach to try to recruit new individuals to our institution with having in-person career fairs. We're also partnering with some of the local colleges and schools. We're looking for a partnership with Challenger Prep, Plaza College, and others to create pipelines for students of these schools to be able to either apply the training that they are acquiring during their schools and potentially offering them permanent positions at the end of graduation to be able to attract and develop our own new team members to this area. So those are some of the things that we have in the works.
Okay, thank you. There's an additional question here from Zoom. How can we get an update on Meditech expense? That with Bill?
We are currently going through a procedure to outline everything that's in there. We expect to make a decision mid-November. And once we have that, we will go ahead and make an announcement to the whole organization with, dates and timelines.
Thank you. Maybe I'll stand in this corner. Another question. What are the plans to improve pediatric services in Far Rockaway? Hand this to Miss Rosemary Bonilla.
So we just hired 2 pediatric physicians that are going to start soon, one in December and one in January. And they're going to be seeing patients at $4.95, 2 part-time physicians. And we're also going to have a study made to see if if 275 Rockaway Turnpike would also support a pediatric practice there as well. So that's what we're doing.
Okay. When are we supposed to get the 3% raise? I think that was already answered, so we'll just move forward.
So it's actually different.
Okay.
So, yes.
Ms. Sharika.
So for members of 1199, they're going to see their 3% increase on their following regular paycheck outside of the healthcare worker bonus payment.
Thank you. What are the future plans for the reflection room in the main lobby?
The only thing I would say is, I don't know, as it currently stands, it's good. There is, if we end up building the optometry program, it's going to take what used to be HIM and the reflection space, but it'll be moved still on the first floor, easy access for everyone. A little bit more square footage. So in other words, it would be rebuilt kind of to the function it has. It'd be a little bigger. Obviously, it's always nice when you get new. But it's going to stay where it is until such time as we need that space for the ophthalmology practice. And that's going to be a while for sure.
I'm not sure if this question is still in relation to what we had just asked earlier, but is there an update on the updated Meditech and a transition from Athena to Meditech? Is that separate? Same? Same, okay. And one other question. What was the vested period used for the healthcare worker bonus program?
So the vesting period was, the first vesting period was October 1st, 2021 to March 31st, 2022. And the second vesting period is April 1st, 2022 to September 30th, 2022.
This one's a little bit more lengthier, but I think some of these answers, some of these questions were addressed. It says, Chris talked about modernization during his presentation. Would this modernization include modernization of internal processes and move away from paper-based to more electronic systems? For example, material request forms and HR processes.
I guess I'll just speak a little bit on the HR processes. As we're looking to enhance the team member experience, those are some of the functions that we're going to be moving towards our more self-service modules, getting away from paper and more access to make electronic submissions and completions.
Thank you.
They are right. We have a lot of paper processes still. So little by little, we're trying to tick them off. So I know facilities is working on an electronic work order program. AP has a lot of papers, facilities improvement still on papers. So little by little, we're going to move into you can just go online and fill the forms out there and submit them. So yes, over the next year, I'd say most of the paper will go away, hopefully.
Great. Another attendee is asking, what is the plans or what are the plans for the clinic's call center?
So we're looking at a vendor right now just to supplement the calls. So we have 3 vendors that we're looking into to give us proposals. And we'll probably have a vendor pretty soon within the next couple of months just to support the overflow. That way the calls will be answered within the time frame that we think it should be answered, which is a minute, no longer than a minute. So that's what we're doing.
Thank you. I'm going to just wait for a few more. It seems like they just are rolling in. How much longer do you think the mask mandate will be required for the EHS staff?
Last week, so.
Yeah, I think at this point in time that, this isn't something that is mandated by EHS. This is, we are following the rules of New York State Department of Health and the CDC, but this is something that we will always be looking towards making sure that we're following the current regulations. But at this time, we'll be continuing to wear our mask, especially as we come into a high flu season. So get your flu shot.
Thank you. Now we have another question that rolled in. What are we doing about staffing throughout the hospital and how to retain staffing? I think we discussed retain.
A little. So just as we're focusing on recruitment, which is a nationwide challenge, we're also in discussion about how we can retain our existing team members to make sure that the employees that we have want to continue their professional careers here. I do not have a plan to share at this time, except for to say that it's a discussion that we are going to be working with our labor partners to talk about what really helps people to want to retain in this environment. And as those things develop, we'll be sharing that as part of our strategic plan as well.
I've seen it asked on Facebook several times. With the rise of crime in the Rockaways, is there any consideration or plan for a trauma center or trauma surgery?
Wow.
It's okay. It's a good question. It's a good question.
Can you hear me now?
It's a good question. Okay.
So this is a good question, and it's one that's been batted around for now probably the last 12 months. We have met with our local elected officials, some of them who feel very strongly about this, some don't feel as strongly, but what we did and have done is we hired an outside firm to come in who has experts in trauma to study trauma in the Rockaway Peninsula and the main zip codes that we serve. You hear about trauma and really the definition of trauma is very specific, and it's very broad in the sense that you could fall down the stairs and that's trauma, or you could get shot and that's trauma. And then there are traumatic events that happen in our lives that are not necessarily considered trauma. Someone has a stroke. Well, that's a traumatic event, but it's not trauma. They have a heart attack. That's a traumatic event. It's not trauma. So we wanted to do a comprehensive study. We formed a committee of community members and politicians, as well as the consultants and the leadership team here, to study trauma. And there are different levels of trauma. Trauma centers are trauma 1 centers, trauma 2, and trauma 3. FDNY in EMS has very specific guidelines for bringing trauma to certain hospitals. And if you're not a trauma center, then we'll go to the nearest trauma center. We have done this study. The presentation of the study will be done for the community association, our community association this week, and then to our board of directors on the 26th of this month as well. The only thing that I can say is from a purely a trauma perspective, and I'm talking because people see in the newspapers violent trauma, stabbings, gunshots, rapes, assaults, those types of things. You think that there's a lot of trauma in the Rockaways, and relative to the rest of the 5 boroughs, it's relatively low. You know, in comparison, our numbers to say Jamaica Hospital, which is a level 1 trauma center. But we want to study it, and we want to provide the right level of care. It's a very expensive process, and it takes a long time in New York State to get trauma certified. New York State is one of the few states that requires not only the American College of Surgeons to certify the program, but the New York State Department of Health. And usually from the time an organization says it wants to become a trauma center, the process to do that is about 3 years. So we are studying it. The report is ready to be finalized. The next steps are presentation this week to the community, next week to our board of directors, and we'll have further discussions with our elected officials about it and make a decision on how we proceed. I think we have all of our data and our current data and good data. And so more to come on that. It was whoever asked this question, a very excellent question, something that is very much on our to-do list. So thank you for whoever answered the question, asked the question. I answered the question.
Okay, I think with that being said, how does that policy on harassment and more specifically bullying a union representative apply in a routine huddle? So these are questions I just want to make note that were asked prior to when we opened up the forum to ask questions prior to.
So I would say that that policy is applied to everyone in our organization, regardless of their title, regardless of the forum. Harassment, bullying is something that is a part of our anti-violence in the workplace policy. And so if someone feels that they are being bullied or harassed within their department, that is something that should be escalated so that it can be addressed.
Thank you. Prior to, again, this is another questions from the form, our Google form. Does the plans for the new building include additional shared conference training rooms like 495 conference rooms?
Clinical Learning Center has, like I said, one really big conference room, which will get used a lot for these kinds of big meetings, but it has 2 specific training rooms, 5 other conference rooms, and then space in the library for the residents and the students. So in addition to freeing up our internal rooms, most of the medical student lectures, the physician grand rounds, the resident teaching and stuff will move over to the Clinical Learning Center. So there's a total of 7 or 8 actual conference and training rooms over there.
Great, thank you. Another team member has asked, what can I do as a team member to help our community know what we have to offer and make sure they're aware that this is a community-based hospital? What type of outreach is available? Is there a volunteer sign-up campaign for us to help educate and improve our standing in the community? I want to help and educate.
That's a great question, and thank you so much for whoever asked that question. I know that the population health team is always looking for volunteers to go out into the community. So please reach out to Lorna Manning. She is the AVP of Population Health and Care Management. And then also you can reach out to Zuleika Benitez, because we do also have opportunities where we're at events for the community and we need people to table to hand out flyers. There's also opportunity with St. John's Medical Group, who also does community events. So you can reach out to, I believe they do have a community health worker out there, but we can definitely get that information to you if you just reach out to the marketing team. You can send an email to marketing@ehs.org and ask that question, and we'll send out all of that information for you. But thank you.
It states here, one team member has asked, what are the plans to reinstate pediatric inpatient services at St. John's? Every child needing admissions is transferred out of the community. I think some of this may have been answered, but.
The PG unit, as it currently sits, obviously, until we can get Tower 11 rebuilt and the other floors kind of situated, will remain med-surg and telemetry. But our pediatric inpatient service, before we had to do this, because the fire was down to a couple of patients a week, so it's a very small service. Most pediatric care is provided in the community, home-based, or in children's specialty hospitals. So, there's no specific plan to say we're not going to have pediatric inpatients, but it is going to be a while. And I do think it's a discussion, that we'll have to have, just given the very low volume of that service prior to when we, switch that unit over.
Another team member has asked, what are the plans to meet the demands of the use of drug and alcohol in this community? I'll hand this over to Ms. Terry Coyle.
So the hospital ourselves, we don't have an OASAS license. We don't actually provide specific drug and alcohol services. However, we do actively manage patients who come to our emergency rooms, who have drug or alcohol addictions. We connect them to care. We provide them treatment on site, and we connect them to care. In addition to that, all of our outpatient behavioral health clinics are also certified by the Office of Mental Health to provide opioid and other substance use addiction services. So we can treat any patient who is dually diagnosed with both a mental health issue in addition to a substance use issue. In addition to that, we've been partnering with some of our local providers. Catholic Charities has just established a new OASIS outpatient license program for substance use. There's another program that's opening soon. At this moment, I can't recall the agency that's running that program, but within several blocks of the hospital, they're opening these two programs. And of course, we continue to partner with Far Rockaway Treatment Center, which is run by Northwell.
Thank you. Some of these are still related to the reflection room and Tower 11. I think these questions were already answered. However, I think if you can offer a maybe better vehicle and to off this particular meeting to answer that question. Is there a plan for Tower 11's rebuilding? I think a lot of that was addressed in the PowerPoint address, the reflection room is another area of concern based off of ophthalmology. Help us to understand if it will be relocated when the ophthalmology plans are implemented.
And also, this town hall is going to be recorded. So you can go on the intranet, and this town hall is being recorded. So you can go on the intranet to retrieve the video, and all of those questions have been addressed already.
Correct. And I think that will also be in terms of the following comments. It says, we're concerned about the crosswalk between Beach 20th and Brookhaven. Some drivers do not respect pedestrian crossings. And is there something that we can do about this? I think this was addressed based off of Renee's answer earlier. Again, the town hall is recorded and it will be circulated.
And I think I just addressed the construction of the street. We put in a survey to have a stop sign put at Beach 20th and Brookhaven, but because the ambulance runs up that street, you can't put a speed bump. So they did a feasibility study and told us that a speed bump was put into place. I believe it's on Beach 20th Street, but going towards Mott Avenue. But it can't be in the area of the hospital. So that's the answer that I got from the city.
These seem to be more of a human resources questions. Are there any work from home plans? And does our talent acquisition effort have the agility to move as quickly as we need?
So we've been having discussions about future of work, just looking at some of the positions that traditionally were here inside the building, that we're going to have to look and have further discussion and evaluation about what are appropriate positions that can work from home. So I don't have a concrete answer to that, but it is something that is being evaluated as we look to also recruit new team members. People are looking for those opportunities where they may be able to work from home. So it's something that we continue to evaluate. With regards to our agility to recruit and try to move quickly. We have expanded our talent acquisition team, and we are constantly working to try to handle the volume of vacancies that we have to fill those positions, as well as support the internal transfer process. And right now, I don't know that the answer is to add 100 more recruiters when there is a national crisis out there on recruitment. So yes, we do have the agility to try to be creative and move quickly to onboard new hires.
Thank you so much. I think this is reflective of that particular same concept, but also dealing with patient cares. It's a team member had asked, what are you doing to up patient care if there's no staffing?
I think that some of the things that we've described, having to get creative, looking at future of work, it may not be the regular shifts that we've had in place, that we have to come up with more creative ways to entice team members to come and work here, to be able to provide the patient care that needs to be provided. However, to say that there's no staffing is not necessarily accurate, because we do use supplemental staffing and our internal resources to fill in any staffing gaps that we may have.
Thank you so much. In terms of, I think, the bonus or the additional payment, somebody had asked, a team member is asking, is everyone getting the same amount?
They would not, because it's based on how many hours you work in the vesting period, but an individual can go on to the website to look at the criteria, and they'll understand how it's broken down.
Thank you. Pardon me. A couple of years ago, we had a blood drive. Do we have any plans for a community blood drive anytime soon? I think this relates to population health and so forth.
No. It's through the lab, but we have had a blood drive in the past, but due to COVID, we did not do it in the past couple of years. But when they do contact us, we will definitely make sure the communication is sent out to all the team members so that you can participate.
A team member has asked, are there any plans for another recharge room?
Yes, there are plans for several more recharge rooms. Unfortunately, we have had to halt on the development of those plans, as you can see from all of the construction and relocation that's taking place. We need the dust to settle, and we have carved out some recharge rooms that hopefully will be going up as the construction is being completed.
Are there any future plans to build a parking area for patients, perhaps a 2-story parking level? Your team members want to know. I know, like, your team members want to know.
We realize the need for additional parking. And so, as I think it's Thursday, right, Steve?
Yeah.
Thursday, we're meeting with a company who does parking structures, open air parking structures, to take a look at the campus for where we might be able to build an elevated parking deck of multi-level. You can also stress those parking structures so that you could actually build space on top of the structure if we wanted to. Very preliminary phase, phase that we're just having this initial meeting with them to see what they propose. But as we've been going through the process with the building across the street, the ambulatory building, and numbers of specific spots that we need, and traffic, and probably the growth in the community alone is going to warrant a study for us to do that. So it was a good question. It's a good question. We are going to study it and see if we could potentially get more parking spaces available as we move forward with the construction.
Thank you. Another team member has asked, can you please give us an update regarding the purchase of new hemodialysis machines? Is this appropriate for? We can answer that. We'll have this to defer.
Good morning. Hemodialysis machine project, we already spoke about that in the hemodialysis committee. We're still weighing on which is the best machine to purchase at this point. We are still, the committee are making sure that we will have the best machine for what we need at the moment. So that is where we are with the project about hemodialysis machine.
Thank you, Lynn. A team member has just asked, any updates on requiring more space in Garden City?
I think the answer is yes, we do need more space. Obviously, we've added in people, and we've expanded, and we continue to grow and expand projects. So we're looking into the potential of adding some more space in that same building that we have out there so that we could keep our back office staff in the same location. So yes, we are looking into it.
Is there going to be any job fairs for the community in the future?
So we just held a career fair in July of this year, and again, we held one in September. We are going to be participating in career fairs that are partnering with other organizations and not necessarily our own. We are doing some sort of targeted recruitment for some of our hard to fill positions within the nursing department and some other titles. So I don't know that we're going to have another hospital sponsored career fair this year, but we definitely plan to at least have them quarterly.
Thank you so much. Just as a quick note, and to all those that are able to listen in either boardrooms or at their personal desk space, we are looking to wrap up the town hall meeting by 12:30 p.m. We are taking a last few questions, and we'll ask a few here. One of the other questions that we have here, asked previously from a team member, is there a budget for staff break rooms and bathrooms?
But I mean, as we're redoing all the floors, when I went through the projects, obviously we're redoing the staff support spaces as we do that. Otherwise, the best way to go about it is just filling out the facilities improvement form, specifically letting us know what it is about those spaces that needs to be addressed. And then, we'll sit and assess and prioritize and see what we can do to make those spaces as accommodating as they can be.
We'll leave the last two questions for health and wellness in terms of team members aiming to create a better sense for themselves. Any chance of creating an employee gym to help promote health and wellness? And are there any plans to for any special perks, employee perks programs?
So we actually have some employee perk programs that are already in existence. If anyone would like to know what they are, they can contact Human Resources or go onto the intranet. They are listed there, from discounts on cell phones, gym memberships, vacations, many other perks that are currently available. And with regards to having our own gym, that is a vision that I would love to see come to fruition. However, right now at this time, there are no plans for us to build an employee gym.
Thank you so much. Don't know if you would like to wrap up the last 5 minutes.
Our town hall meeting. This wraps up our town hall meeting. And just again, to reiterate, this will be recorded and posted on the intranet. So please, if you came in late, you can just go on our intranet and view the recording. If you have any additional questions, you can always send questions to events@ehs.org. We will receive it and try to get those answers back to you if your questions were not addressed today. But we want to thank everyone for tuning in. We want to thank everyone for coming into the conference rooms, and we hope that you all have a wonderful day.
Thank you.